So what's this test that we keep implying somebody might need if they never had it before? Well, the name of the test is called computerized infrared thermography. And what it's looking for an underlying neurological problem stemming from the upper neck. And the reason this test is super important is because the function of the body, the neurological function specifically, is often an area that's overlooked. Many people have had x-rays or CT scans or MRIs, even blood chemistry testing. And those take good snapshots of the body, whether it's a part of the body or what's in the blood at that moment in time. But none of those tests look at the overall function of the body. And in some cases, that's where the answer is going to be found. Now, the test actually looks like this. It's a handheld device. We gently just roll this up the back of somebody's neck or their spine, and it makes some graphs on the screen, as you can see behind me. Much like an EKG machine would give graphs for the cardiologist to read and interpret what's happening with the function of the heart, these graphs behind me tell us what's happening with the function of somebody's nervous system. And in the case where somebody hasn't had a very good response, or maybe no response at all to traditional healthcare interventions and traditional treatments, they keep having recurring and stubborn and chronic problems. In a lot of those cases, what's been missed is the careful relationship between the spine, especially the upper neck part of the spine, and the function of how their body is being controlled. Every gland, every organ, every tissue, every muscle takes direction from the nervous system. So this screening test that we use with thermography is a way to figure out if somebody has an underlying neurological problem that may be explaining why they have chronic and recurring symptoms. Now, this is an actual screening test, not just some fancy sales pitch. The whole appointment takes about 15, maybe 20 minutes, and this test is not provocative, which means it doesn't make anything worse just by testing you. If you have dizziness or anxiety or what have you, it's not going to make any of that worse just by taking a look. It's quick, it's painless, and if you have this underlying connection or this underlying problem with your nervous system coming from your upper neck, of course, we'll tell you about that, and then we'll explain what the rest of the testing process looks like. The biomechanical x-rays that we take, the other hands-on orthopedic and neurological testing that we do to really fully round out the clinical picture. And if you don't have what we're looking for, then of course we'll tell you that as well. Not everyone who comes in for the screening test is told they have this problem. Some people have something else going on, and we'll do our very best to point you in the right direction or connect you with another doctor in an area that does something different and hopefully stands a chance of helping you. So if you haven't had a functional or neurological test and you're struggling with stubborn and recurring symptoms of some kind, now may be the time. All you have to do is fill out the form below, give us your first name, your contact info, and a little bit about what's been happening with your body. We'll have you come in for about a 15 or 20-minute appointment. We'll do the screening test and we'll take it from there. There's no charge, no obligation. It's just information we're looking for and a test you probably have never had before. All right, hopefully we'll see you in the office. Take care.